no problem with that. But we are asking that we restrict the use of these medicines to those trial settings and not use them casually around the country. So if you want to, let's restrict the use of chloroquine, hydroxychloroquine, and all the other antivirals previously in our guidelines to contexts where clinical trials are going on, so that we don't use things that we're not sure about their use. So that's the second major change. The third one is more for us. We've clarified how we define a death from COVID-19 so that the reporting of this is more straightforward and standardized across to get this document out on time so we can use it to manage our patients more effectively. Thank you very much.
The Chairman, Presidential Task Force, Honorable Ministers, members of the PTF, gentlemen of the press, good evening. First of all, I would like to briefly talk about the impact of COVID-19 on our health services, both in terms of the quality and also access to care. As you are aware, the whole world, rightly true. However, as a result of this, we are seeing a situation where other health conditions are not, health services are not concentrating on other health conditions. If anything, the emergence of COVID-19 has led to the detriment in terms of care for other essential health services. And this negative impact included reduction in health services that could arise from disruptions in medical supply chains, or the ability in a decline in people accessing health care simply because of fear of getting infected by COVID-19. For misdiagnosis of other conditions, and for the most vulnerable populations like children, the elderly, and those with underlying illnesses such as diabetes. As I've said in the past, if you have fever today in Nigeria, it's far more likely it's going to be due to malaria than due to COVID infection. And we've also seen life-saving maternal, newborn, and child health services, routine vaccinations, access to care for chronic conditions such as our hospitals used for COVID infections to make sure that they have proper assessment processes for people presenting with possible COVID. They must have holding areas and screening be able to deliver care. Hospitals are there to look after patients. Hospitals are not there to turn patients back. People should not be, we must not allow us of COVID or because we are afraid of it. The PTF will continue to protect the health and safety of health workers, both in the public as well as the private sector. We are appealing to the private sector facilities to make sure they have adequate PPE to protect this. PPE will do other arrangements for their own PPE. If they are having difficulty accessing this, they should please get in touch with us and we can point them in the right direction. Having said this, we continue to thank our donor partners and our partners within the private sector, particularly the few that continue to provide excellent care to persons with COVID. In fact, the response, which will be all about risk communication and community engagement. We will continue to work with all parts of the communities, religious leaders, traditional institutions, state and local governments, to make sure that that behavioral change we all need to adapt continues. We must learn to live with the new realities of COVID-19, especially as we are still far off.
Thank you very much. That concludes the update segment. We're not taking any updates from the sectors this afternoon. We'll move straight to the questions session. Can we have our colleagues? Okay.
Good afternoon, sir. Members of the Presidential Task Force on COVID-19. My name is Yemi Adebayo from AIT. I just have three questions for the PTF this afternoon. And the first one, I remember clearly that on Monday, one of the guidelines passed, the SDF and the National Coordinator could respond to this. One of the guidelines contained in the second phase of the gradual easing of the lockdown issued on Monday states clearly that there will no longer be evacuation of Nigerians. That is, for now, it has been halted, and that for now there is no date yet that this will take place. Some Nigerians who are out there who are willing to return home, they are asking that the PTF could probably tell them a date when this exercise will commence again, due to the fact that countries around the world are making frantic effort to ensure that their people return back home. They want to know what specific date would this exercise commence again. Then secondly, sir, the DGNCDC, sir, the SDF just mentioned that efforts are on to cut down the rate of infection among medical workers through an intensive training by the NCDC. Beyond these, I want to find out from you, sir, what other efforts are you putting in place to ensure that these our frontline workers are safe? Then finally, sir, a viewer wants to know the motive behind the change in time of the curfew from 10 p.m. to 4 a.m. He wants to know, is it that the new time is when the virus moves? Thank you very much.
The chairman of the task force, members of the task force, my colleagues. My name is Amaka Ude. I report for Arise News. And my first question actually is a follow-up to the new guidelines the DG spoke about earlier. I have seen the guidelines that you posted on your website, but there was one key part I feel that wasn't addressed there, which is the part of managing those that have been discharged from the isolation centers, even though they're still positive, but you told us that yes, they might not still be viable to transmit the virus. So a guideline for their family members as to how they should manage them at home, especially if they still have some mild symptoms. Would need some clarifications on that. And also, in a bid to ramp up testing, the Lagos State government has actually started a validation process for rapid test kits. The reason I'm bringing this question to you is the fact that you have repeatedly told us, and even the health minister today said, rapid test kits are still not reliable. But for the Lagos State government, they said they need as much help as they can get. So what they've done now is they've actually gotten some people with the rapid test kits to go through some scientific process, which at the end of the day, they said they will get a NAFDAC registration number for them and they can use this test kit. So my question to you is, will the results from this rapid test kits that go through all the science process be taken by the NCDC? And my next question is for the National Coordinator, Dr. Sani. Well, Dr. Sani, since the beginning of the pandemic, domestic violence and sexual assault have been on the increase. And of course, recently we've heard all sorts of cases of people who lost their lives. Beyond even those who were either raped, we've even heard stories about women in labor who were turned back by security agents because it was past curfew time. Is there a way that the PTF can adjust the protocol to ensure that for emergency services or probably people who have been assaulted or people probably that have been robbed and shot or just any medical emergencies, even if they have no clearance, be allowed to get to the hospital? Thank you.
Good evening, members of the PTF. My name is Juliana Tayo Baloyen. I write for the Sun newspapers. My question goes to the Minister of Health and maybe the NCDC DG. Honorable Minister, sir, there have been countless complaints about public hospitals branding people who have not been through proper NCDC testing as being COVID-19 positive. Several petitions, I understand, have been sent to your offices, both your offices, and they complain that their corpse, their dead have not been released to them and have been addressed that these people are not COVID-19 positive. They want to know if their dead was not positive, how come you are insisting? I'm sorry, I need to take this again, sorry. So they are saying that there have been countless complaints branding these people as positive when they are not. And they have written petition to your offices, that's the Minister of Health office and that of NCDC. So they want to know what can be done. Why are you not releasing their corpse to them? Kogi State has denied sending any sample for testing. Where is the NCDC getting its sample? Thank you.
Good afternoon all. My name is Friday Okerigwe. I'm a reporter with Channels TV. I'd like to start my question with the new guidelines for case management that the NCDC DG spoke about. I need clarification. I don't know if I got you well. You said antiviral drugs have been removed. If that's exactly what you said, I'd like to know if antiviral drugs have been removed from the management of a viral disease, what then are you using? I'd like to seek clarification on that. Then my other question goes really to the Minister of Health. Earlier this week, I think it should be on Monday or Tuesday, you told us about the number of bed spaces that we'll have in the treatment centers. You said about 5,000 from the 112 treatment centers. Yes, it's in your speech. From the 112 isolation and treatment centers across the country. So I did a little mathematics. We have over 11,000 confirmed cases. When we subtract the discharge, those that have discharged, and those that have suffered fatality, we subtract them, we have over 7,000 active cases as we speak. So if our bed spaces in the treatment centers are just 5,000, have you given approval for management of confirmed cases in private clinics, or where are the over 2,000 being managed as we speak? Then I also have a question for the PTF coordinator. I'd like to know, post-COVID-19, do we have a policy document that we can hold on to that is currently guiding the national response that you are leading? I'm saying this because I know that the Ministry of Health, in 2013, for instance, will have a national guideline for response to outbreaks of diseases. And also there was a similar one in 2018, which is actually a four-year document. Post-COVID-19, is the PTF National Response Coordination guided by a document that we can hold on to, or you are still developing? And unfortunately, we have the WHO country representative here. I'd like to hear from the WHO. Why was the use of chloroquine suspended? And now, just a few weeks after the suspension, we have resumed. What did you find out that led to the suspension and then the resumption of the use? Thank you.
Good evening all. Rachel Abuja from the News Agency of Nigeria. My first question is to the DG NCDC. Sir, this study from Singapore was very clear, so I don't know why you're adding extra 4 days. Meanwhile, is it that we don't have compassionate drug in the country already? Or we are just trying to get these drugs as compassionate drug in Nigeria? My next question is for the chairman and my Minister for Information. Sirs, countries like South Korea, Germany, and Singapore, they have certain measures where certain measures were put in place to prepare the mindset of their nation workforce. It's called productivity readiness, And now that we're in our second phase, going to the third phase, I don't know if we'll be preparing maybe our workforces through educative and inspirational programs that can be aired on television like twice a week or every day to prepare their minds as we move into the new normal. Meanwhile, my third question is for the Minister of Environment. Sir, recently the United Nations Executive Director Environment Program described COVID-19 as a clear warning shot from nature. This means transformational nature readiness is needed in Nigeria as it is now. So I would like to know what your ministry will be doing in order to make Nigerians connect to nature and climate change, and of course the people, so that in the era of this pandemic as such. So thank you very much.
Good evening, the SGF ministers, DG and CDC, my colleagues. My name is Rohila Lassa and I report for Voice of Nigeria. My question is for the SGF, and I want to know what the government is doing about the transport sector, because with the reduction in the number of passengers taken by public transport, the transport fare has doubled or more than doubled. So I don't know if the federal government is putting something in place to cushion the effect of COVID-19 on the public. Thank you.
Good evening, Chairman and members of the Presidential Task Force and Nigerians at home. My name is Mitaire Igben. I report for the NTA. I want to ask the SGF or the National Coordinator of the PTF. Now that the PTF is cascading the national response down to the subnational level, what are the plans for building the capacities of the state governments? And who will fund the response? Will there be any assistance in terms of funding to the state governments for facilitating the response to the pandemic at the state levels? And for the Minister of Environment, what is the update on decontamination across the nation? For the DG of the NCDC, I want to ask, what are you doing to identify asymptomatic patients, since they present no symptoms and they probably walk around not knowing that they have the virus? Thank you.
Thank you. We have taken all the questions. We'll be receiving responses from the Honorable Minister of Health, the DG NCDC, the National Coordinator, the WHO rep. Then we'll then take from the Honorable Minister of Information and Culture before the Chairman wraps it up. Let's begin with the Minister of Health.
Thank you for the questions. Some of them appear to be related. If I understood Juliana properly, because you have to do your question to COVID-19, we have no symptoms, or they have very